respiratory sounds are weak. What about in other areas? As I thought, the other areas are normal. They're only weak in the lower left lung. It's some form of lung abnormality, for sure. Roni, get approval for an X-ray exam. We need it done right away.
Understood, Doctor. The X-ray exam is now available. New symptom observed. Attenuation of respiratory sounds. X-ray images are ready for viewing.
Sounds good. Let's see them. White shadow in the lower part of the left lung. That's definitely a sign of fluid accumulating in the thorax. So we know she has a lung abnormality, Roni. Let's narrow down the candidates.
Understood, Doctor. New symptom observed. Pleural effusion. Doctor, would you like to narrow down the diagnosis candidates?
Of course. That's why I came here, right? Carcinomatous pleuritis. All her symptoms apply to it. We'll need a CT scan to confirm the diagnosis, though. Roni, how's our patient doing?
She's not doing well, Doctor. Please return to the examination room immediately.
That's what I thought. All right, let's go check on her.
My chest. It really hurts bad now, Doctor.
Her condition's worsened even further. We can't continue on with the diagnosis. Roni, request a room immediately. She needs to be hospitalized and her symptoms need to be treated.
Doctor? No. I can't just let the symptoms be treated. Can you please continue examining me?
Huh? Do you know how much of a risk you're in right now?
I finally thought that I could live. I had a new kidney. I recovered from the operation. I could finally live a life on my own. So please, Doctor, please find out what's wrong with me. Please cure me.
Roni, cancel that hospitalization order. Let's finish the diagnosis.
With all due respect, Dr. Cunningham.
What? You always rant about how I need approval from the patient when it comes to performing exams, but you won't listen to the patient when it comes to hospitalization and diagnosis? When things are inconvenient, we should push all the responsibility onto the patient? Spend all day worrying about how to avoid a lawsuit? To hell with that!
Understood. I admit even I find incongruities with the protocol that I have been designed to conform to. I think I shall add, to hell with that, into my computer registry.
My thoughts exactly. Right. So it's X-ray time again. And order a CT scan as well.
Understood, Doctor. The CT examination is now available.
Put them on the display. I want to see what's going on. Found something. Tumor shadows. Roni, make a note.
Understood, Doctor. New symptom observed. Tumor shadows on lungs. X-ray and CT.
Put them on the display. Put them on the...
The patient, please finish gathering the symptoms and make a prompt diagnosis.
Yeah, I can't overlook anything. I need to check the images carefully. This? Hey, Roni, this shadowing.
I anticipate this is a new symptom, as it was not confirmed by the previous X-ray.
A new symptom? Don't be ridiculous. I've never heard of anything like this suddenly popping up inside someone. Roni, collate the data and check what it is.
Yes, Doctor. One moment, please. There is no matching data. It is an unconfirmed symptom.
Damn it! What's going on?
There is a less than 1% probability of ascertaining what it is from the data at hand. I recommend that you remember the shadowing for later and continue with the diagnosis.
Yeah, you're right. We can't spend any more time on this. Roni, let's continue with the diagnosis. Alright, I think I have enough to make a diagnosis. Let's get back to the office. But still, what in the world is that shadowing? We should have all the symptoms now. Roni, I'm gonna make a call on the diagnosis.
Understood, Doctor. Displaying the diagnosis candidates.
There's no mistake that it's carcinomatous pleuritis. But I'm not convinced. Skin to the small intestine. Small intestine to the lungs? How can a focus that devours the human body at such a rate exist?
Doctor.
Oh, sorry. What is it?
No further progress can be expected at this point. The diagnosis will be completed temporarily. I will leave the cause of the disease as unknown and call attention to this case.
Yeah, you've got no other choice. I'm stumped. What am I supposed to tell her?
Well done, Dr. Cunningham. Ending the diagnosis.
Doctor, are you all right? Is something wrong? Please, you can say it. What's wrong with me?
I'm sorry, but I can't say anything for sure yet. Please be patient. I want to keep you hospitalized a bit.
That's fine, Doctor. I'll put myself in your hands.
I'm sorry. I promise I'll do everything in my power. Hey, Roni.
Do you need my assistance, Dr. Cunningham?
Another little trick of yours, huh? Sounds useful.
I can utilize this facility's entire installation network.
Huh. All right. So, what do you think about that patient?
I found no reasonable matches within the current literature. I suspect it is an unidentified condition.
Well, for once, I agree with you. It mirrors Kaposi's sarcoma, but it spreads much faster.
I estimate the entire lung will be affected within 20 days.
We don't have time to sit and think. We need to treat the skin, lungs, and small intestine all at once.
An operation like this would yield a 10% success rate.
There's no other options, though. I'm stumped.
Should I request a hospice transfer and notify her family?
The earth was blue, but there was no God. We did all we could. Now, we just have to hope for the best.
One thing I've learned over the years, never give up.
I'll be assisting. A specialist's coming in for it.
That's it! Roni, you said you have access to the full facility, right?
I did, Doctor.
All right. I want you to look up OLCVR data. Records, footage, surgeon name, contact info, everything. I promised I'd do everything in my power. Well, I guess I gotta follow through with that.
Scout, and the Coker's forceps too. Hurry.
Isn't the boy just superb? Now are you glad he's here?
Yeah, thanks to you. I'm in your debt, I guess.
You threaten me so you can use him, and then you thank me.
Hey, no threats. I just asked you to lend him to me.
Of course not. Still, I have to say, it takes guts asking for such a big favor to save your patient. Well, son, I guess you and I are square now.
To save a patient, huh? That's nothing noble like that. Yeah, the patient made it. I called in a special surgeon.
I see. And the cause of it all? Could it be an epidemic?
I can't say. Like you, I'm getting a bad feeling here.
We need to look into this as soon as possible, then.
Yeah, you're right.
Gabe? You sound tired. Did something else happen?
Nah, it's nothing. I've just been fed up with myself lately.
What's wrong? You don't seem like your usual self.
Yeah, don't worry about it. Anyways, try and get over here as soon as possible.
Well, alright.
Gabe, you there?
Of course I am. Some of us can't loaf around on the job.
How sweet. I'm gonna let that one slide. Your patient's being discharged today, but she wants to see you.
The lady with Kaposi's? I wasn't the one who saved her. If she wants to talk to someone, call her surgeon.
Oh, hell no! That guy is a serious asshole!
Whatever. I don't plan on going down there either. Anything else?
Yeah. There's one more thing. We're understaffed and the chief wants you to take this one.
Is that all? Well, give it here. But the patient's... Joshua?
Well, if you don't want to, I can ask another doctor.
What kind of doctor would I be if I chose my patients? Roni, let's start the diagnosis. Bring up the charts.
Yes, Doctor. The patient's name is Joshua Cunningham. He is related to you by blood, Doctor.
Is there a problem?
Negative. But I can request a new doctor if you prefer.
I'll be fine. Man, they really programmed you well.
I must take into account the feelings of those around me. Observing colleagues allows me to gather their emotional data.
Yeah, you're perfect. Now you just need to learn how to talk.
Oh, hello. You're a new doctor.
Yeah. Hello, Joshua.
Doctor, I don't hurt at all.
That can't be. I received a report from your nurse.
That's weird. I'm all right, really.
Well, let's check you out. If I can't find anything, I'll let you go back to your room.
Okay. I'm sorry, Doctor.
Roni, I'm beginning the diagnosis. Are you ready?
Yes, Doctor. You may proceed.
I feel fine. I clean my plate, and I don't hurt at all. I'm just here because the nurse said I had to be examined, but I feel just fine. You think maybe she mistook me for some other kid? Oh, but don't blame her. She's real nice. She's always worried about me and does a lot. I wonder, maybe I did something bad. She was really worried about me.
That's odd. He really does seem to be fine.
Yeah, I mean, there's nothing wrong with me.
Well, all right. Just to be safe, let's finish examining you. What in the heck? He doesn't have a single symptom I can find.
Oh, I'm sorry. It's just a cough.
That looked rather strenuous. But it's just a cough? Roni, the patient's hiding something. I'm continuing the exam.
Understood. Proceeding with the diagnosis examination.
Did I look like it hurt? Oh, come on. Not you too, Doc. I'm fine. See? I'm totally fine. Can't I go back to my room yet?
The boy's breathing pretty rapidly. Roni, make a note of it.
Understood, Doctor. New symptom observed. Rapid breathing.
His heart rate's increased. Is this a symptom? Roni, record this. I think this is a definite sign.
Understood, Doctor. New symptom observed. Increased heart rate.
seems that earlier attack is causing symptoms to appear. There it is again. There's no mistake about it. Hey, show me the hand you covered your mouth with, right now.
Huh? It's nothing. Come on.
Jeez, this kid's gonna try and hide as much as he can from me, huh? I need to see what's on his hand. I need to get him to use his hands. What can I do? Blood on his clothes. He still had blood on his hand when he lifted his clothes up. The boy coughed up blood a moment ago, and he tried to hide it. Roni, make a note that the patient has hematemesis.
Understood, Doctor. New symptom observed. Hematemesis.
Hey, kid. Why are you trying to hide your symptoms from me?
Why would you say that?
I know you coughed up blood earlier. It's on your clothing.
Oh, it's just some blood. I'm full of the stuff. I'm fine.
Seriously? Who do you inherit this attitude from? Well, we're done talking. I need you to undergo a few tests for me. Roni, get approval for an x-ray.
Yes, Doctor. The X-ray examination is now available. The X-rays are ready for viewing.
All right. I need to be thorough here. Can't miss anything. There's a cave-in in the gastric wall. The contrast medium is settled in it. Well, this is definitely proof. You can't make excuses anymore.
New symptom observed. Caved-in gastric wall.
I have proof that there's something wrong with your stomach. You ready to talk now?
My tummy hurts once in a while, but that's it.
So he does have stomach aches. What an idiot. I bet they hurt a whole lot too. Well, Roni, he's finally coming clean with us. You writing all this down?
Yes, Doctor. New symptom observed. Stomachache.
Yeah, I don't feel like eating when it hurts. What's wrong with that?
You don't feel like eating, huh? Well, given your stomach's condition, I'm not surprised. Roni, make a note.
Understood, Doctor. New symptom observed. Lack of appetite.
Everyone keeps making a fuss about it, but it's nothing. Really. Doctor, I'm okay. Seriously.
All right. Now, is there anything else you're hiding? This is your chance.
I'm not hiding anything. I really am okay.
Man, that little runt. Time to go back to the office and continue with the diagnosis. All right. Now, is there anything else you're hiding?
I'm not hiding anything.
Man. We have at least a few symptoms to work with, Roni. Let's start narrowing things down.
Understood, Doctor. Displaying diagnosis candidates.
Is it a gastric ulcer? That's odd. Joshua already had endoscopic surgery recently. There's gotta be a reason for the relapse. Roni, let's continue with the diagnosis.
Yes, Doctor. Sending the request to continue diagnosis.
Something's wrong. The ulcers have returned.
I anticipate there is an underlying disease, Doctor.
Yeah, I just hope there's no other complications.
That would be very beneficial, Doctor. Should we begin?
Let's do it. You're having a relapse of gastric ulcers, which I'm guessing hurts a lot. Why do you keep trying to hide your symptoms from me?
There's nothing wrong with me. I really didn't notice it.
Just stop it. There's no way you're all right. Now listen to me. I don't know why you're pretending to be fine, and I don't care why. But the more you keep this up, the more you make everyone around you worry about you.
But
Whoa, there's no need to explain. If you don't want to talk about it, then that's fine. I've got permission from Lisa. I mean your mother already. Roni, get the examinations ready. If he's not going to talk, then I'll find out myself.
Understood. Doctor, please calm down.
Sorry.
The X-ray, CT, and analysis exams are now available. Doctor, the X-ray and CT results are ready for you.
Let's take a look at him. There's an abnormal break in the bowel gas. Roni, record that.
Understood, Doctor. New symptom observed. abnormal bowel gas in intestine.
Damn it. Maybe I was a bit harsh. Serum amylase seems unusually high. Roni, add that to our list.
Understood, Doctor. New symptom observed. High serum amylase level.
The serum lipase level is a bit higher than I'd like it to be. Roni, record that.
Understood, Doctor. New symptom observed. High serum lipase level.
His elastase level is elevated. Roni, you got that?
Understood, Doctor. New symptom observed. High elastase level.
Let's take a look. This isn't normal. His pancreas is swollen. Roni, make a note of it.
Understood, Doctor. New symptom observed. Swollen pancreas.
We've got a lot more to go off of now.
Doctor, we need the patient's cooperation for any further examinations.
Yeah, you're right. I should try talking to him again. Well, I may have been a bit harsh earlier. I wasn't being professional. But you also...
Doctor?
I know. Just be quiet. Anyways, I want to cure you completely, and everyone is worried about you. Joshua, will you please cooperate with the exams?
Sorry.
Huh?
I'm sorry. I'm sorry.
Hey. Hey. It's all right. Don't cry.
But it's all my fault. I didn't want my mom or that nurse to worry about me.
Joshua.
I'm really sorry. I just made everyone worry even more. I won't hide anything anymore. I want to get out of this hospital. So, please.
Yeah. I understand.
Actually, my tummy feels a little weird. Can you check it out, Doctor?
Of course. Leave it to me. Roni, are you ready?
Yes, Doctor. I am fully prepared.
All right. Let's continue the exam.
I'm sorry that I lied all this time. It's not just my tummy. My back's been starting to hurt too.
Back pains. His condition must be getting worse. Roni, make a note.
Understood, Doctor. New symptom observed. Back pains.
It doesn't hurt so much that I can't bear it, but it hurts a lot. Also, I don't feel well. I feel like I'm gonna throw up any minute.
Feels like he's going to vomit, huh? Sounds like he's finally telling the truth about something. Roni, this is important.
Indeed, Doctor. New symptom observed. Nausea.
If there's anything more, I'll tell you right away, Doctor.